Okay, this PowerPoint is on the topic of oral rehabilitation. Here is some technical definition. Here are some technical definition. Um, you'll notice that the R and the E are in parentheses before habilitation. So rehabilitation is kind of bringing back function to pre-hearing loss levels. Habilitation is that initial process. So young kids that are born with hearing loss, and you're not rehabbing essentially, you're facilitating their development. These are other words that people have used for oral rehabilitation: audiologic rehabilitation, habilitation, rehabilitative audiology, and so forth. Again, that's just the same thing I just mentioned. So here's ASHA definition. AR is an ecological interactive process that facilitates one's ability to minimize or prevent the limitations and restrictions that auditory dysfunctions can impose on one's well-being, communication, and psychosocial, educational, and vocational function. If you look in eCampus, when you look in eCampus, there's a lot of resources in there. There's checklists. There's a whole bunch of things. There's a chapter by, I think it's Mary Pat Moeller, and she's a really good author, really good researcher, and it's all about AR in children, and it is a very, very important chapter for you to read. Okay, lots of good information. I would even print it out and keep it with you when you're in clinic, because there's a lot of good information in there. So oral rehab is anything that facilitates hearing, understanding of hearing loss, coping strategies, acceptance of loss, and then anything involving communication partners. So AR is a broad term. Here's the team: audiologist, SLP, deaf educator, communication partner, so somebody that they're communicating with a lot, ENT, psychology, classroom teachers, basically everybody who's involved. Here are some of the goals. You can read over those: to enhance the activities and participation, to limit the negative effects of hearing loss on a patient and their significant others. And then also the counseling component about realistic expectations with hearing aid use, cochlear implants, and so forth. So these are some things that are important about the hearing loss: the degree, or how much hearing loss. We know the more hearing loss somebody has, the poorer their ability to understand speech, the more physiologic damage that has occurred. Individuals with more severe hearing impairment require different types of activities: the configuration, the type of loss, the time of onset, and then the speech recognition ability. And we talked a little bit about the onset, and then the onset of use of hearing aids and how that's important. So prelingual hearing loss that occurs before basic language structure is developed. Perilingual is kind of during that time, and then postlingual is after the basics of language are learned, and they say 5. Of course, that's up for debate. People will talk about that. But postlingual is after they've learned language fairly well. Just think of it that way. So auditory speech recognition ability refers not to audibility of sounds. This is how well they understand speech. Because you may have patients who have moderate, severe hearing loss, and you can amplify things. You can amplify the environment. But if their speech recognition ability is poor, then they will still struggle despite hearing environmental sounds. Okay, so we always talk about audibility, the audiogram, hearing basic sounds versus speech recognition ability, and they're two separate skills. The AR assessment: basic audiogram obviously is important. Speech and language, look for any kind of issues there. Do some kind of checklist to look at their needs, evaluate hearing aids and cochlear implants, and deal with that part. And then any kind of self-report. So here are some things. We're going to look at the auditory the auditory abilities, visual abilities, motor, cognitive status, what can they handle? Case history, any kind of medical issues. So we may have somebody who's more advanced in age and has something like retinitis pigmentosa or some kind of glaucoma, cataracts. Their vision's affected, so speech reading's going to be tough, right? Or other things like that. For younger kids, they're educational. Kids as they get to middle school and high school, vocational things. How can we help them in those activities? Socioeconomic status has a lot to do with if they're really young. We know that there's a controversial study that was done years ago, and it looked at the number of words kids were exposed to in different classes. And so it wasn't a perfect study. I can't remember the name of it. Different classes or socioeconomic status. So people who were on government assistance, they said, were exposed to X number of words, and then middle class, and then professional parents. I think it was called the 2 million word gap or something like that. And while that wasn't a perfect study, it did show that there were some differences in the amount of stimulation that these kids who come from lower SES backgrounds get. The intervention is designed to capitalize on the strengths and weaknesses related to the hearing loss. What do the people do well? What don't they do well? What they don't do well, we need to try to modify either the environment, if they don't hear well in noise, right, which is always a complaint for patients who use hearing aid. What are we going to do about it? Are we going to have them sit in different places in school, preferential seating? What are we going to use an FM system? Okay, and we'll talk about those. The intervention provides information and guidance to patients, families, significant others about speech and language development. Give them a kind of a prognosis is important. So depending on the age, intervention will address some of these things. If it's early on, with the parents, a lot of information about kind of back and forth, how to interact with the child. As they get older, speech and voice production, we see that a lot with adults who are trying to make their voice sound less like what they term kind of deaf speech. And so auditory training the ear and the brain to perform better in different environments, communication strategies, education, and then short and long-term communication goals with specific objectives. So when you have communication, you have a message, you have some kind of feedback, you have the environment, and then the receiver, and you can look at each one of those. But the message is the thought, what's going to be expressed, it's organized in a certain way. The feedback provided to the speaker, allowing the opportunity for adjustments. So if there's some kind of breakdown, in my AR class, we talk more about how to kind of facilitate breakdowns. And I'll talk about that in that chapter. The environment, the communication situation, and then the receiver, right? And they're the one that are receiving and decoding the message. So parameters of speech and some of the things that you'll see in terms of hearing loss, sometimes you'll see issues with voicing, right? And so if they have a more severe loss, what happens? They have trouble maintaining that consistent fundamental, so it might kind of jump around a little bit. Sometimes their voice sounds a little nasal. Sometimes they have misarticulations because their tongue, vowels for people with hearing loss tend to be more centralized. So most of the vowels are kind of produced in a more central way instead of in the front or in the back. And so you see that a lot. You'll see a lot of final consonant deletions of the S sound, the SH sound, the TH sound. You see that a lot. And then you see issues with intonation, rhythm, stress, pitch, particularly with the more severe hearing losses. The more mild to moderate, you don't see that as much. You see that more with the more severe losses. This is from a text, and again, this is what we talked about 2 days ago on Wednesday. Your awareness or detection, your discrimination, your identification, and your comprehension. This is the auditory skill hierarchy, and again, when we're assessing people during AR, during a general therapy session, we have to determine where they are. Okay, child, adult, it doesn't matter. And then we have to develop activities that are appropriate for where they are along the auditory hierarchy. Okay. The goal of auditory training is to maximize communication abilities. So this is just, activities. Some of them are computerized. Some of them you might develop. You might do some speech and noise training where you create a background noise and you work with somebody and you try to have them, you work on understanding speech and noise. You can do it in a soundproof booth. You can do it lots of different ways. Speech reading, we don't do a lot of that anymore. I mean, some AR clinics focus a lot on speech reading. I mean, we encourage people to use visual cues because there's a bunch of factors: the speaker, the signal and code, the environment, and then the speech reader. In particular, the speaker. Some things that you want to do and not want to do and don't want to do if somebody is lip reading is you don't want to use inappropriate facial expressions. You don't want to be too expressive. You want to be face to face. You want to be within about 45 degrees. You want to use a slightly slower than normal rate, not like I'm talking. There's something called clear speech, and we know that clear speech is about 10% slower and about 10% louder, and it's much more understandable for individuals with hearing loss. You want to avoid chewing, yawning, big mustaches where they can't see your face. You don't want to put your hands in front of your face. And the signal and code, the visual properties of the isolated speech can changes when it's placed in a sentence form. Essentially, there's more linguistic cues going from a word to a sentence. And so the redundancy in language makes it easier to lip read. And some sounds are easier to see than others. So if you're going to start kind of a speech reading or lip reading session, you want to use sounds like sounds that are produced up front, puh, buh, right? Things that people can see. The environment, you want to be within about 5 feet, within 45-degree angle. Want to have an appropriate amount of lighting. Okay, that's important. And so manual communication, we're not going to go through all these, but ASL is the most common. And there's other kind of sign English, other types, but most individuals use ASL. Okay. So some of the psychosocial aspects of hearing loss, you have emotional development, family concerns, social competence. One area that individuals with hearing loss struggle with is called theory of mind. I don't know if you guys talk about that. You might talk about that in kind of the pragmatic language context. But theory of mind development is something that can be negatively affected by hearing loss. But hearing aids, cochlear implants, creating the ability to overhear people, that's how we develop a lot of times this theory of mind where we understand that people will think different than we think, so it's if you're not familiar with theory of mind, I would look it up. I would become familiar with it because that's part of the pragmatic language, the pragmatics of language. Okay, so I'm going to stop here. We have a few slides left, and we'll finish that up and I'll post it.